Hi friends, I'm Dr. Datta Ram. I'm a consultant surgical gastroenterologist and laparoscopic surgeon, a GI-HBP Onco surgeon practicing in Hyderabad. So March is considered to be the colorectal cancer awareness month, and today I'm going to talk about the common symptoms of colorectal cancer. As you all know, most of the cancers are very trivial or silent to start with when they are very small or very early stage, and by the time symptoms develop, they are all fairly advanced. It's very important to understand the symptoms of colorectal cancers. Symptoms, the most common symptoms what I see in my clinical practice are blood in stools. This is the first and the foremost symptom with most of the patients come. They notice blood in stools, and it's very mild quantity, and they are often, many patients, they ignore this symptom and expect it to settle by itself, and they attribute it to piles, and they take some over the counter medications. Bleeding in piles is very different. It's often separate from stools. It doesn't mix with stools. It is often very bright red blood. So, and it's painless. So bleeding in, though most of the cause of bleeding per rectum are benign, but one should understand that even a cancer of the rectum and the colon can present with blood in stools. The second important symptom what I feel is change in bowel habits. So this is very important, and most of the patient they don't appreciate this change in their bowel habit. Change in bowel habit means that if you are like to say you start passing stools more frequently, you're going to the washroom more often than before, you're more constipated, and you pass semi-solid stools, and there is also change in the caliber of the stools. A feeling of incomplete evacuation, that is feeling of not emptying the bowel properly. So this is one very significant symptom. The patient often tells that they have to go to the washroom again and again, because each time they go they pass very little, and still they feel that they have stool to evacuate. So the fourth important thing is abdominal cramp. Many patients, due to this, they have abdominal cramps, they have gaseous distension, lower abdominal dull aching pain, etc. And because these cancers bleed, so many patients do develop present with anemia, that is low hemoglobin. When these cancers they bleed, and the blood is often not noticed, it goes unnoticed, and it's very trivial. It's only microscopic bleeding, that is their occult bleeding. So these patients, they bleed over a period of time and develop low hemoglobin and anemia. So they get exhausted very easily. They get exhausted very easily. They get fatigability. They can't do their routine work. If you see that they are anemic, they have low hemoglobin and they are anemic. So unexplained anemia, unexplained low hemoglobin should be evaluated for a cancer of the gastrointestinal tract, is the upper gastrointestinal tract and the lower gastrointestinal tract. I would like to reiterate that fact that any cancer is curable or well treatable with good survival outcomes only if it is diagnosed very early. So late diagnosis of a cancer at advanced stage, it's very sad to say that the outcomes of such cancers at such an advanced stage are inferior as to when the patient is diagnosed early and treated well. Thank you so much.